The motor system can be divided into two separate areas, the lateral motor tracts and the medial motor tracts. The lateral motor tracts are made up of three separate ones known as the lateral corticospinal tract, the rubrospinal tract, and the lateral medullary reticulospinal tract. These tracts are all responsible for distal muscles. The medial motor tracts consist of the anterior medial corticospinal tract, the tectospinal tract, the pontine or medial reticulospinal tract, the medial vestibulospinal tract, and the lateral vestibulospinal tract. These are all responsible for trunk and girdle muscles.
The lateral corticospinal tract. It controls distal muscles. The lateral corticospinal tract arises in the motor planning areas and primary motor cortex. Axons go through the corona radiata to the internal capsule. After they pass through the internal capsule, they will then go to the crus cerebri through the midbrain. Axons cross to opposite side in the decussation and become the corticospinal tracts in the lateral part of the spinal cord. They then synapse with the locomotor neurons in the spinal cord and control the distal muscles.
Rubrospinal tract primarily innervates flexors and inhibits extensors. It originates in the red nucleus of the midbrain. It crosses to the other side in the midbrain tegmentum. It descends through the pons, the medulla, and the lateral cord is synapsed with locomotor neurons. The axons project to all levels but predominantly in the cervical cord, and it's responsible for your decerebrate and decorticate posturing.
Medullary reticulospinal tract. It inhibits and facilitates postural muscles and limbs. It begins in the medullary reticular formation and travels bilaterally. It has inhibitory input to the nucleus of cranial nerves 7 and 5, and it works during gait. Sometimes it inhibits and sometimes it facilitates, depending on what needs to be done at the time.
The anterior corticospinal. This controls girdle muscles and the trunk. It begins in the primary motor cortex and supplemental cortex. Like the lateral corticospinal, it travels through the corona radiata to the internal capsule. It travels through the internal capsule and the anterior brainstem. It does not cross at the decussation like the lateral corticospinal. It ends in the cervical and upper thoracic cord and then crosses over in the cord to bilaterally control the axial and girdle muscles.
Tectospinal tract. This helps with reflexive vision and hearing. The tectospinal tract originates in the superior colliculus. Most cortical fibers that project to the spinal cord are from the visual cortex. It crosses in the midbrain tegmentum, and from here it projects down to the cord in the tectospinal tract. It activates lower motor neurons in the cervical cord to turn the head to a loud sound.
The medial or pontine reticulospinal tract begins in the pontine reticular formation. It remains uncrossed as it descends, sending facilitatory input to the nuclei of cranial nerves 7 and 5. It facilitates the postural muscles and limb extensors.
The medial vestibulospinal tract is responsible for head and neck writing. It begins in the vestibular receptors known as the semicircular canals and otolith organs. These receptors take information about the head and neck and send it to the medial and inferior vestibular nuclei, which are located in the pons and upper medulla. From here, the information is sent bilaterally down the cord through the medial vestibulospinal tract to the cervical and upper thoracic levels. This tract again is responsible for the writing of the head and neck. The lateral vestibulospinal tract is responsible for protective extension. When gravity pushes down on the vestibular receptors, such as the semicircular canals and otolith organs, information is sent into the lateral vestibular nucleus, which is found at the junction of the pons and medulla. Information is then sent ipsilaterally down the lateral vestibulospinal tract to facilitate extensors and inhibit flexors through an inhibitory interneuron.